Welcome, Catherine. Just a few words by way of introduction. So just in case people don't know about you and your work, and it's extensive, so I'll try and summarize. But Professor Catherine Crock, medical pioneer, producer of music and theatrics, humanitarian, mother, grandmother, and advocate for change. That's a number of job descriptions right there. Apart from being a pediatric physician, you're also chair and founder of the Hush Foundation, with the aim to create music that provides a calm and healing environment for patients. So the Hush Music Foundation is a registered charity transforming healthcare by improving partnerships, culture and the environment so as to support health and wellbeing. It's raised millions of dollars to fund health programs in paediatric centres across Australia. You're also recognised internationally as a leader in the development and implementation of patient-centred care, patient safety and better health outcomes. In 2015, you became a member of the Order of Australia for your contribution to medicine, community healthcare standards and to the arts. And also a Monash Fellow in 2020. So just to throw that in as well. So we're going to find out all about you and your work and the work of the Hush Foundation and the importance of music and kindness in healthcare. So can we just start off by finding out a little bit more about yourself and your own journey from becoming a paediatrician to like where you are now? How did that all come about?
Well, Craig, I'll be taking you back about 30 years when I first started work as a doctor looking after children with leukemia and other life-threatening illnesses. And I was in my mid-30s at the time and actually found it really quite hard, quite a challenging environment. The children were often distressed when we were doing the things we needed to do for them, their bone marrow tests and lumbar punctures. And these are children who are coming over a 3 to 5 year journey. And I was looking at the situation and thinking, my goodness, what if this was happening to my children or somebody that I knew? How would I want it to be? And it really was the start of my patient-centered care journey, because I sat down with a group of the families, and that was a little bit unheard of in those days. But I got a plate of sandwiches, 7 families, and I said, tell me about the journey. What are some of the things that we could be doing differently to help you on that journey? Because I was noticing the distress in the children and in the parents, but it was at a time when they didn't really have a voice. They didn't have a way to feed back to the healthcare system that this wasn't necessarily always working for them. And what they came up with were extraordinarily simple and wonderful, useful and constructive things that we really needed to know to be able to help make improvements. And I can give you an example of a few of them. So one of them was music. They said, well, the environment is very threatening when we come into a big, busy hospital or a healthcare space. And what if there was some calming music to help in that atmosphere? Now, my children were learning from professional musicians at the time, and I thought, well, I'm not exactly sure what we should be using. I tried some classical CDs, but as you know, with classical music, it can have some, really beautiful, gentle music, but then it'll have massive crescendos or crashing cymbals or whatever, things that were actually obviously not going to work in my treatment room. And so, that sort of got me really linked in with these musicians and thinking, let's tap into their expertise. And I think this is something I've always done. Let's bring people with variable expertise to the table together, and then we can start talking about it and see what we all come up with. And the composers really didn't understand the hospital system. So I thought, well, let's bring them in and stand them in a corner of an operating theatre, or put them in a busy waiting room or an emergency department or intensive care unit, and let's see what they think. So it was quite an extraordinary reaction from the composers. they were blown away by the incredible work that people are doing in healthcare, but under some quite difficult settings. So very noisy and chaotic. And they said there's a cacophony of noise in this environment that will be raising everybody's anxiety, not only the children, but the parents and the staff who are dealing with it. Now, that was not something that I'd really thought about. How's this sound environment affecting us when we're doing our work? So getting that perspective into the room was really amazing. And the composers would say, we're going to have to think really carefully about where this music can sit in this particular sound environment so that we're not making it worse.
Yeah, so they really, right from the start, you got people involved to specifically write music. Was the music that they were writing, composing, was it qualitatively different from some of the kind of usual kind of music that would have been played?
Yeah, look, I think so. A lot of the composers who've worked with Hush actually come from a jazz or a neoclassical background. Several of them have been professors at Monash, like Paul Grabowski and Tony Gould. And yeah, the music that they wrote for Hush was different to what they would normally write, I think. Tony Gould in particular said it was a life-changing experience for him. Another composer, Matthew Heinsohn, said that he's composed subtly differently from that day forward, from when he came in and had that experience. So it hasn't only changed the music that he wrote for Hush, but the way he thinks about what is his music doing out there in the world.
Well, in one of our contemplative studies units, we look at different wisdom traditions and their meditative contemplative practices. But one of the things is each week we have contemplative music from those traditions. Is the sort of music they're writing, was it contemplative, almost meditative music? And when they were writing it, were they experiencing some kind of meditative or contemplative state or experience?
Look, I think they may well have been. We have done a piece of research we haven't yet published about interviewing the composers about what's going on in their minds while it was all happening. And they're talking more about how they were thinking of the other people and the receiving of the music rather than what it was doing for them. But also, I think they were not only thinking of the children, they were thinking of the big picture. And that if this is going to work in this sort of high pressure, high stress environment, then it's going to work for the general public. And the other thing I was wanting to say to you was they were not necessarily writing gentle contemplative at all times, because they're thinking of music that can take you to another place, and it might be quite intricate and involved and even quite active. So not necessarily, first of all, we were thinking, is this going to be a type of lullaby music? We've got some of that, but in fact, a lot of people have ended up writing music that will engage your brain and have you in a different zone, if you know what I mean.
Well, and a lot of contemplative music is, look at the Indian tradition and the ragas and so on, can be very active, but have this sort of magnetic effect for the attention. I suppose, is it a matter of the attention drawn to the music, and so the sort of hyperfixation on a procedure or some discomfort, sort of it's drawn away and given to the music? As it sort of help in that kind of way? Is that how the music was?
Yeah, that's what we're finding over all these 25 years that we now have been writing and producing this music. That's exactly what we do find. And I think it can take the children and the families away from all the machines in the room and the people around them and some quite imposing things that are anxiety producing. We also now use the music with some visual cues on video screens, which we didn't have in the early days, but now we've got fish and turtles and some beautiful landscape photography and videos that go with the music. That is like a, surround sound, a really enveloping them in a really beautiful environment. And I think they do forget somewhat what's actually being done in the way of the procedures.
Yeah. So what kinds of effects do you notice for the children, but also for the family, the friends, the siblings that might be there? And perhaps after saying a bit about that, also for the staff, have you noticed changes for the staff as well?
Yes, so for the children, we're bringing them into an operating theatre, putting them off to sleep for these procedures, bone marrows and lumbar punctures. And the way they go off to sleep, the calmness that we can get them off to sleep, actually relates to how they wake up in recovery. So an anaesthetic is almost like a bit of a gap. And how you were before you went off to sleep will be how you wake up. So to have that a nice, calm experience makes a big difference. And then you have to think that these children are going on to the oncology ward to have their chemotherapy, or they're going to X-ray to have something else done. And so the flow-on effect through the whole journey is great. And the same thing for the parents. If we can have the parents feeling relaxed and calm and safe and secure in our environment, that definitely impacts on how the child will feel and behave. And that carries on for the whole journey. So the other effect is the staff, and it wasn't something we thought about actually for quite a few years until we had a couple of emergencies happen in our theatre where you have to press the buzzer or something untoward's happened and people are feeling stressed. And it would be the nursing staff who'd say, thank goodness we had that music there in the background just to, chill everyone down and to help us to really focus on that emergency. And it's also been, for me, a bit of a device or a Trojan horse for having some conversations about how we all treat each other. So if we can think about the environment that we're in and we're working in, then it actually became easier to start talking about kindness and respect and teamwork and how all of that fits together to make a safe and secure environment.
Yes, you have quite a lot of interest in workplace culture, but in this context, the medical workplace culture, which doesn't always get glowing reviews and can have some problems. So what are some of the kind of cultural pain points, and how have you been able to help sort of shift that culture to something that's maybe more supportive for staff, and then, of course, how they help patients?
Craig, I might just go back to 2010 when I did a Churchill Fellowship trip about patient-centered care and patient safety. And I was actually having trouble getting some traction with the idea of let's bring the patients and families to the table and we'll all talk together about making improvements and in quality and safety. And I wasn't sure why people weren't just going, this is a great idea, we need all of this feedback into the system to help us. I think it was seen to be disturbing the status quo in some way. That
shining a light where people didn't want light shone.
No, because the system was working okay for us. But what I was finding was the patients and families were saying there's all these gaps where things fall through the cracks and this department doesn't talk to that one, or when staff are rude to each other, we don't feel safe. We don't feel that our child's care is going to be safe. And to then bring some of this back to the staff was causing some unhappiness and conflict, instead of being taken in the way that the families were meaning it to be, which is totally constructive and helpful. And if things were done differently, this would be better for us. Even some simple things about timing of outpatient appointments and people who would get an appointment for cardiology on Monday and one for gastro on Wednesday and then something else on Thursday. And they've come from a long distance 3 times in that week and we haven't coordinated it. So simple scheduling things. The constructive feedback was amazing. So I thought, well, I'll go on a Churchill trip, which gave me the opportunity to link patient-centered care with patient safety and really pick up on some of those things that the patients and families know that they have to have a way of feeding it back to the system. And I was lucky enough to meet some extraordinary patient safety experts who were starting to think about the biggest safety issue actually being how staff treat each other. And they don't have the capacity to take on this patient-centered care extra piece if they're not feeling cared for by their colleagues, by their organisation, if they're really struggling in their work. And like you were saying, there are a lot of pain points in the health workforce. When I came back from the Churchill, I connected with Alan Hopgood, an Australian playwright. And Alan had written a few plays about his own healthcare journey with prostate cancer. And I thought, here's an idea, let's write a play about some of the culture and behaviour and the things that might be going on behind the scenes that are impacting on patient safety and staff safety. So Alan and I collected true stories from the front lines, from patients and families and from staff. And our first play, called Hear Me, is about a devastating medication error when no one listens to a mother who knows there's something the matter. A common story, we still hear them today. So the mother had information that the system needed to hear and nobody was prepared to listen. They actually labelled her as difficult. And then this information was lost and her daughter died. The junior medical staff were not feeling supported by some of the senior staff and were feeling unsafe to speak up even if they made a mistake. We've put this play on over 200 times in hospitals around the country and internationally. And it was the feedback from every audience that's seen that play, Craig, that had me really worried about the crisis in the culture in healthcare and how staff and organisations are treating each other. But I like to think aspirationally and positively. And so in 2015, I got 100 people together from all walks of life. We sat together for 2 days up at Mount Macedon in a beautiful garden, and we talked about what is a kind health system and how can we get there? What are the pieces that we can all bring to the table to make this kind for the people doing the work? So kind organisations, kindness between your colleagues, looking after yourself as well. Kindness to yourself is absolutely critical if you're going to do the hard work in healthcare. And then when we get that right, it's kind for the patients and families.
So were you able to develop programs or things to actually deliver for training at like before, like undergraduate training, or is this more for already trained health professionals? And how did the training, how was that received?
Look, this is for everybody in the system. So we've talked a lot to medical schools and nursing schools, but particularly organisations that are up and running. And I could say that from all the 200 organisations we put on the play, there's not one that says we've got our culture sorted. And so, I mean, it's a work in progress, this idea that kindness really matters and is integral to safety for everybody. And I'd have to say, in the early days, using the word kindness was seen to be a bit soft. Mm-hmm. But COVID made a difference, I think, that over the COVID years, even though we could no longer gather together and we had to do everything virtually, we had an enormous buy-in of people wanting to talk about kindness and how that was impacting them in a positive way. Mm. So we've got a yearly, what we call the gathering of kindness. So bringing people together. And in fact, gathering of kindness is next week. World Kindness Day is next Thursday. And so all of next week, we've got online programs and then one live event on the Thursday. And for the rest of the year, so that this is not flash in the pan, we'll do kindness for a week and then we can go back to business as usual. We have a kindness in action program that organisations can sign up to. What we've been learning from the feedback from that is everybody's tired, they're burnt out, they're overwhelmed, and what they want are short, sharp, and to the point actions that they can do in their own workplace. So we've got some amazing tiny videos and then just some prompt questions that you can think about yourself or you can use with the team. How do you huddle as a team and get the best out of that, potentially first time you've all met and worked together? Or if you're an established team, how do we keep our relationships as healthy as they possibly can be?
Yeah. Well, I remember a few years ago now, when you came to Monash one day, and yourself and myself and Michelle Leach and Julia Harrison from the medical faculty. Debbie Ling wasn't, I think, there that day, but she's very much involved in the development. She was really one of the key drivers of developing compassion training for the medical students. And so we developed an online interactive sort of course, so not just for health professionals, but to deliver it to the medical students. So that's been going tremendously well. One of the key themes that comes up there is how to deal with the empathic distress.
Yes,
Distress
exactly.
comes that, that this very natural human resonance with somebody else's suffering, but recognizing it empathically, but then stepping into distress rather than into compassion. And that's quite a fork in the road to take. What sort of strategies to give people, because it's not just for health professionals, any parent who's got a distressed child or a friend, how do you help people to take that step from empathy into compassion and kindness rather than empathic distress?
Look, I think part of it is the checking in with the other person and how you might be able to help, and then having some practical things that you can do that actually are what that other person is needing. So there's things like with the checking in, we had a friend who was talking about seeing somebody struggling with a big door when they're in a wheelchair. And he raced over and he grabs the door and he pulls the door open. And the person in the chair said, "Oh, look, thanks, but I'm actually really trying to work out how to manage this myself." And so you can leap in and you can do things, or you can actually reflect on what the other person might actually be needing. And for people working in a health setting, they're finding the message of kindness actually very empowering, that it is something that you can do yourself, even if you're in a department that's not particularly kind or an organisation that's not particularly kind. You can, with your own small acts of kindness, start this ripple that then spreads out amongst the people around you. And one of the terms that we've started to use is kindfulness, which I think you would see where this is coming from. But the idea that if you start to notice acts of kindness, not only in yourself, but in other people, you become more and more mindful of it. And it is this amazing ripple effect. It's very easy when you're in a stressful situation, particularly a hospital, to see the negative in other people or in the situation. Turn that around by being kind, mindfully kind to other people, and you watch it grow.
Yes. My mother was in hospital a little while back, and just noticed so many acts of care and kindness, such a lot of, from lots of different fronts. It seemed to me at the time it was really important to acknowledge that and
Yes,
say thanks for that. And just not just any particular, but just the care that she'd received over the period of time that she was there. And I suspect that's also very important, is to express the appreciation or thank. But I guess you've got to be very present to even notice, because if we're, lost somewhere in our own thinking, we often miss lots of acts of kindness that are going on every day.
absolutely. And sometimes just pointing this out to people has really given them such an amazing mind shift and really helped to improve teams. And really, I mean, one of the things that I like to think is assume good intent of your colleagues and the people that you're working with, because it is so easy to say that person didn't do this thing or they didn't do something as well as they could, and missing those acts of kindness that have actually been happening the whole time.
Yes. It's it's easy to miss the challenges that people are dealing with, the demands on them, and to expect perfection is, so being a little bit more forgiving, I suppose, is very important. I just want to inquire a little bit more about the healing potential of music. How can that help?
Look, there's good research, Craig, about bringing down people's blood pressure and heart rate and the stress hormones that go with being in a difficult healthcare situation. Music can, by its rhythm, by its engagement, can bring all of those stress things down and make a big difference. So there are studies on it improving wound healing and healing after surgery, etc., reducing mental health problems from having the right sort of music. It's such an important modality, and I think we really are not using it to its full potential.
Can you say more about that? Like how should it be used? I mean, not just in the hospital, do you mean, but more widely in the community, in the classroom, at home?
Classrooms for sure. We've taken our hush music into quite a lot of classrooms, and the feedback from the teachers is it really helps the kids to settle and concentrate better. And in fact, one school had all the kids reflect on what did it mean to them. And they said, we think we can concentrate better when we've got this music in the background. And, I know some surgeons will work to a head-banging type of music, but in fact, I'm not sure that is necessarily where the rest of the team needs to be able to work at their best.
Yes, you certainly wouldn't want to turn around and see the anaesthetist banging their head on the.
No, look, I will tell you one funny story. Back in the day when we used CDs and I had a CD player, I put my music on the CD player and went out to get scrubbed at the sink, and I came back in, and unbeknownst to me, the anaesthetist had swapped my CD. And it was off at the time. And so I used to go over and just with my foot, because I couldn't touch anything when I'm scrubbed, turn the CD player back on. He'd put Heidi's yodeling music on full volume in the CD player. And the whole team and the patient and the mum were in on the joke. And I went as red as a beetroot. And it was a great moment of humour, which is another way that you can reduce the stress.
Yes. Yes, good that you were able to see the funny side of it.
Yes, but Heidi's yodeling music won't be on a Hush CD anytime soon.
Well, you should ask your patients. They might say, well, it really connected.
Exactly. So recently, Craig, I've been working with a group who are doing virtual reality goggles for various procedures, and they're using video of underwater scenes, etc., but the hush music as the background. And that's having enormous effects on taking blood tests and finger pricks and things from children.
It's interesting, isn't it? Because, I mean, the sensation is the same, of having a needle or any other procedure. The environment is the same. Just interesting how this shift of, having the music there changes the experience of that. If we're in one state of mind, something, the suffering associated with something can be amplified enormously. If we're in another state of mind, it can be diminished enormously, which is not to pretend that whatever's there is there. I mean,
That's right. Yeah.
like that's a kind of an alchemy, really, turning, iron into gold.
It is. It's all about brain chemistry and what we're able to do with music and other modalities. Yeah, it's fascinating.
Do children learn like important lessons for life from learning to deal with the adversity in this kind of way? Do they take things away and say, this is more than just something that's useful when I'm at hospital having a procedure? It'll teach me how to cope with adversity or stress in other settings?
I don't know that they're thinking that at the time, but certainly we can see progress in kids, particularly the ones that we see over years and years. And it's a big investment by the staff and the parents to work through all of this, particularly if there's anxiety over procedures, but definitely gives them life skills for later on.
Yeah.
And ways of coping and things they can bring with them to help them cope, such as the music.
Yeah. Now, Kath, would you be happy to take some questions?
Yes, that would be fun. Thanks,
Yeah.
Craig.
Excellent. So, Jakob will come back on in a moment. Now, there'll be some questions in the Q&A. There might be some that are in the chat as well. And so we'll see what people have come up with as well, particular things that might have come up or, been raised by some of the things that you've said as well. While we're waiting for Jakob to come back on, here's Jakob. But I was just wondering as well, did you have formative experiences yourself in coping with adversity that you used that really pointed you in this direction in your formative years?
Not that I can think of, except having a father who was very focused on kindness and respect.
Mm.
So I had an upbringing of following Dad, who is an orthopedic surgeon, around on his ward rounds when I was about a 12-year-old, and actually seeing the good and the kindness and the impact of that.
Mm.
And then when I got into a system that wasn't really like that and wasn't focused on those things, it gave me something of a fire in my belly to take it in that direction. And I think bringing music, which had always been part of my life, suddenly it made sense. Let's bring this to work with us. Given that the patients and families are asking for it, let's really get this right. But it also helped me, I think, navigate a challenging healthcare system as a junior doctor.
It's marvelous what a role model or two, what a difference that can make. Setting an example. Yeah.
Yep.
Now, Jakob, we got some questions that some of our...
Yeah. I'll start with the first one here, which says, thanks for the session today. I feel that music programs would be very beneficial for adults in hospital. 2 hours in hospital for months and never heard any music programs.
Yeah. We are definitely working on that. So at the moment, we're doing a project with Cabrini Hospital, and we're hearing exactly that from the patients that we were sitting with, that they would love to have more music, either individually or as background music in various settings like waiting areas or where you might be having some long day treatment. But I think you're absolutely right. Calming adults who are in a stressful healthcare setting is just as important. We've also been working in mental health, the Women's Mental Health Hospital that Cabrini's running down in Elstonwick. Worked with the patients and the families and brought a group of composers in to think about how do we work with adult mental health settings.
There's a nice follow-up on this question about adults as well. So one of the attendees says, is more of this being used for adult patients too? I recently had surgery, and before going into theater, we were put in a waiting room with calming music reclining chairs and hot blankets. It was the best experience prior to the experience itself. So a nice follow-up on that.
Yes, it makes a huge difference. And I've had surgery myself actually during COVID, which was particularly scary because no one could come and see you and everybody was masked up so much. But I certainly had music playing 24/7 to keep me calm.
Good. So here's another question about the music. How do you decide which type of music can help a mixed group, children, parents, and staff feel calm? Do you base your choices on any background research or averaging studies? And how do you handle situations where people have opposite emotional reactions to the same music? And there's another person writes, another entity writes, how do you manage the different preferences of music in communal spaces? What is music to someone's ears may be distressing to another. So what thoughts go into that?
We're always very sensitive to that, and we check in with the families whether this is suiting them or not. What we've got with the Hush collection is now 25 hours of quite eclectic music. So we've always got different things that we can try, but we've never had any serious reaction to anything and anyone saying, quick, turn that off. But we certainly would be alert if you needed to. And yes, there are definitely individual differences. I think it's about giving people choice, saying to people, bring your own music, things that you know calm you if you happen to be having surgery or going into a healthcare setting.
And continuing on the music theme here, thank you for such an interesting conversation, Craig and Catherine. Do you have anecdotes of music or songs containing lyrics that have had resonance, efficacy, and supported your programs, Catherine? And if so, do such lyrics bring a therapeutic focus to an atmosphere or setting?
That's interesting. We haven't used lyrics very often, but we did with an album that we did in 2016 called A Piece of Quiet. And for that one, we actually interviewed children about big life questions, what they thought really mattered. And it was the lyrics of the children that we've used. That album is very engaging and beautiful, and the words of the children, particularly how they talk about relationships and kindness. And we had children who had been through medical experiences. So some of them talked about finding their brave. Absolutely beautiful lyrics about what they needed internally to get them through the process of being a sick child in hospital. So yeah, lyrics can be very powerful. The other time we've used lyrics is in a mother-baby album. So the composers actually talked to pregnant women or women who had just had children, and then wrote lyrics and songs around that for calming in a maternity or a neonatal setting.
So here's a question that goes into the kindness side of things a bit more, and goes back to some of the themes you discussed just before. I would appreciate to hear more about the method that you use to explain the kindness that one develops over time. So how do we cultivate kindness over time, and perhaps the compassion that is embedded in it? So what's the method for developing this over time, I think?
The method, I think, is just break it down and keep it very simple. So start with observing kindnesses. And as I was saying, then being mindful of what is going on around you. It's very easy to get a bit blinkered and just be doing the job without actually noticing those kindnesses. And what we tend to do is suggest that people just start having conversations about this. In a health workplace, at first it can be quite uncomfortable and seem a bit too personal to be finding out exactly how your teammates or your colleagues might be feeling. So even when I started doing this probably 15 years ago, it was a little bit of an uncomfortable setting. but we encourage people just to get started. And then once you are noticing kind acts that other people are doing and having gratitude. So we'll do a theatre list huddle in the morning and get to know our team, run through all the work that we have to do, and then at the end of the morning come back together and say, okay, that was great. Look, I'd like to thank Craig for how he helped with a certain thing, and Jakob, when we were really under stress, you were able to pull it all together and keep us back on track. It's an unusual thing often in a healthcare setting to do that and to give the good feedback to each other that we need to help build really good teams.
I know as a junior doctor, you know, there's so many stresses and tensions, a steep learning curve you're on. And, you know, those moments of encouragement or support or understanding made a massive, massive difference. You know, just to confidence or your willingness to, you know, step back in and all of that, those kinds of things. It was just made a huge difference.
Exactly. And if we take this back to something that really matters, which is the safety of the system, when you, as a junior doctor or a junior nurse, feel fully included in the team and you're treated with kindness and respect, you're way more likely to put some valuable information back into that team and to feel safe to speak up. So I think that's one of the big values of thinking kindness. So I've got a sort of analogy of, say, a bathtub, and the whole team is standing around the bathtub. Each of us have got a tap, and we can choose to turn on our tap, which is our flow of information into the bathtub, which is going to help us do the work. If you're feeling afraid or not involved, you're very unlikely to turn on your tap of information. You'll just quietly stay in your corner. The encouragement that can come from a senior person next to you or another teammate or someone even helping you turn on your tap if it's a bit difficult. Think about that and getting the best information into the pool that we can all have. And that's what kindness can do.
So a slightly broader question to follow on this. Do you think that the focus on safety in healthcare is mostly nowadays focused on physical aspects? And if so, should there be a greater attention to psychological safety for both staff and patients?
Oh, absolutely. Yes, that's the solid gold. And if we focus just on the policies and processes and all our checklists, etc., we're missing a very big piece, which is if it's not psychologically safe, if people don't feel they can put their information in when it's needed, we won't get to a safe place. And nowadays, I think organisations are going to need to look at that carefully. The new WorkSafe regulations coming in for healthcare and for hospitals means that psychological safety for staff is absolutely on the agenda and so important. And once staff are feeling psychologically safe, it's actually a small step for the patients and families to feel likewise they're psychologically safe. And I think without staff safety, the patient safety is really at risk.
So before we take the next question about the substance, there's a nice comment here that says, "This is fabulous. Where can I get some information about this program?"
Okay.
Should we Google the Hush Foundation?
We've got a website, hush.org.au, and a lot of interesting things happening next week. So people can have a look at our online sessions next week or come to our live one next Thursday night. And then into the future, the Kindness in Action program that people can look at for individuals or for teams. It's all on the website.
Yeah,
great.
And we can also post some links and so on for everybody as well.
That'd be great. Thanks, Craig. And the music is all up there on Spotify and Apple and all of those normal places. although we are trying to work out how we might be able to run it through our own website instead of other places.
So maybe we've got time for one or two questions to returning to the music now. So have you looked into the ways that music can be used with patients with dementia in particular? For instance, to bring back memories, but maybe also in general for dementia is something that is on many people's minds, I think.
Yes, look, we've used our music in aged care and palliative care quite extensively. And even though it is not necessarily familiar music, there is a familiarity about it, and the way that it's been written so that it can calm people, we've found it's had a fantastic effect. My own dad ended up with a journey through dementia for many years, and we would have the music playing for him much of the time, and the staff in the aged care setting that he was in found that it was just an extraordinary way to keep him calm, but also then they started using it further down the ward. So I think it's very valuable and important.
Great. And a kind of related question, but broadening out things, maybe even also relevant for any vets in the audience. Is music as a therapeutic modality unique to humans? And if it is unique to humans, what might its evolutionary explanation be? And we can follow up a little bit, because a lot of us have seen on, Facebook and other places, Instagram, videos of people playing music to animals.
Yep, certainly. We've had reports of the hush music being used in like a lost dogs home, where the dogs used to howl a lot, and they started to use the music, and they really calmed the howling of the dogs. That's the only example that I've got. But evolutionarily, music's been used for healing for thousands and thousands of years. Really, music had its roots in healing.
Well, I think finishing on that very
Profound
note just rounds off the octave very nicely for this conversation today, Kath. And so thank you so much for giving your time and sharing your insights and your wisdom. I'm sure we're all going to take something away from that. And just to be a little bit more conscious of what sort of music we put to cultivate the things in ourselves that we really want to cultivate.
Yeah, that's right, Craig. Thank you. It's been amazing talking to you. Thanks very much.
Thank you.